Are you taking bisoprolol and noticing changes in your sexual health? You're not alone, and it's worth understanding what might be going on. Bisoprolol is a beta blocker prescribed for serious cardiovascular conditions, including heart failure, angina, and certain arrhythmias. It's an important medication for many people, but some men taking it do experience erectile dysfunction, and it's a topic that doesn't always get discussed openly. Erectile dysfunction means persistent difficulty achieving or maintaining an erection sufficient for satisfactory sexual activity, typically lasting 3 months or longer. According to UK regulatory data from the MHRA, sexual dysfunction, including impotence, is listed as a rare or uncommon adverse reaction to bisoprolol. So, whilst it does happen, it doesn't affect every man who takes it. Here's something really important to understand though. The relationship between bisoprolol and erectile difficulties isn't straightforward. The cardiovascular conditions that bisoprolol is prescribed for, things like heart disease and high blood pressure, can themselves affect erectile function by impacting blood flow throughout the body, including to the penis. So it isn't always easy to separate what's caused by the medication from what's caused by the underlying condition. Both can play a role. If you're experiencing erectile difficulties whilst taking bisoprolol, the most important thing to do is speak to your doctor. And please don't stop taking bisoprolol on your own. This is really critical. Stopping a beta blocker abruptly without medical supervision can lead to serious cardiovascular complications, including rebound high blood pressure, worsening angina, or even a heart attack. Any changes to your medication must be guided by a healthcare professional. When you do speak to your doctor, have an honest conversation about what you're experiencing and when it started. They can help work out whether bisoprolol is likely to be a contributing factor or whether your underlying condition may be playing a bigger part. In some cases, a doctor may consider switching to a different type of medication. Research suggests that certain alternatives, such as ACE inhibitors, ARBs, or calcium channel blockers, may have a lower likelihood of causing sexual side effects, but whether a switch is right for you depends entirely on your individual medical situation, so that's a conversation to have with your clinician. If you develop severe chest pain, symptoms of a heart attack, or severe breathlessness, call 999 or go to A&E immediately. And if erectile difficulties are affecting your quality of life or mental well-being, that's also a valid reason to raise it with your doctor sooner rather than later. If you experience a suspected side effect from bisoprolol, you can report it through the MHRA Yellow Card scheme at yellowcard.mhra.gov.uk. This helps regulators monitor the safety of medicines for everyone. So to recap, bisoprolol can cause erectile dysfunction in some men, but it's listed as a rare or uncommon side effect. Erectile difficulties may also stem from the underlying cardiovascular condition itself, not just the medication, and you should never stop bisoprolol without speaking to your doctor first. There are safer ways to explore your options together. This video is for general information only and isn't a substitute for personal medical advice. Always speak to a healthcare professional about your own situation and never make changes to prescribed medication without their guidance. If this was helpful, let us know in the comments. We'd love to hear your questions. And if you'd like more straightforward health information like this, please give this video a like and subscribe to the Bolt Pharmacy channel.